This Nuffield Health IT training video has been created to give our staff an understanding of the systems used within a Nuffield Health hospital. We're here at the Nuffield Health Guildford Hospital, where we will see the systems we support within IT and learn how they interact with our staff, patients, and the overall customer journey. During this video, we will answer 3 key questions about each system. What is the system used for? How does it link with other systems? And what is the impact at site when the system is unavailable? The first point of contact for our patients is reception. The reception team use a number of applications, but we'll begin by looking at PIMS. PIMS stands for Patient Information Management System and is primarily used to check in patients, as well as for registrations, bookings, billing, and pharmacy dispensing. PIMS is used by all hospital staff, commercial departments involved in billing, and of course Nuffield IT, who administrate the application. Most commonly, users experience issues with user accounts and PC and printing configuration. The PIMS application may stop working or experience issues for a number of reasons. Usually it's due to either the connection to Citrix, performance issues, or the connection to the database. This can lead to additional problems throughout the hospital. Patients cannot be checked in by reception staff and are also unable to be discharged. Consultants will be unable to check if their next patient has arrived, and staff have to spend time calling IT to log and resolve the issue. This may also affect the customer's experience due to increased waiting time. At check-in, the receptionist will also take payment or store payment information to be used at a later date. This is done through a system called OCS. OCS is a unique chip and pin application which uses handheld terminals and is available as a wired or wireless solution. OCS is linked to an application called Webcom, which is a web-based application allowing the monitoring, management, analysis and reporting of financials and transactional information. This application would mainly be used by the hospital business office. When OCS is experiencing problems, it may lead to a loss of revenue as the staff are unable to take payments. It can also cause patient aggravation, as the hospital may be forced to take payment at a later date. Some Nuffield Health hospitals have a specialist pathology lab and teams who can run a number of clinical tests tailored to a patient's needs. If a hospital does not have a biomedical scientist, it may be linked to a separate pathology hub where another specialist will analyse and screen the tests. Some of our most popular tests performed at Nuffield hospitals include fatigue screen, full blood count, liver function test, and sports profile testing. Most of these tests are performed using specimen or blood tests. The doctor will take a blood sample from the patient, which is then sent to the pathology lab to be run through an analyzer. The analyzer sends the results to Instrument Manager, usually referred to as IM, and the pathology team check and release the results into WinPath, the pathology administration system. On occasion, issues can occur with these pathology-based applications, such as the following. The analyzer may not send information to Instrument Manager. If WinPath is experiencing issues, the transfer of data from pathology may be delayed. If these systems are unavailable, the results may need to be manually input into WinPath from the analyzer. Manual data entry can increase the risk of human error and ultimately cause a delay in the visibility of results for consultants and patients. Another speciality within the hospital is the radiology department. Doctors or healthcare professionals may recommend a CT scan in order to accurately diagnose certain conditions. A CT scan stands for computerized tomography and uses X-rays to take images of the body and internal organs. Within the imaging department, there are both radiographers and radiologists. Radiographers are trained to take X-rays and scans, whereas the radiologists specialize in interpreting them. When a patient arrives for their scan, the radiographer will check them in on CRIS, the radiology information system used to attend patients in the imaging department. The application manages the workflow of a patient's journey through the radiology department, from a consultant sending a request form for a scan within the outpatients department, to generating appointments in CRIS, adding new events to the diary, and managing bookings. CRIS sends a message to the PACS and Modality workstation to add the patient to the work list. PACS is the picture archiving and communication system. We'll talk more about this application shortly. If CRIS was to become unavailable or experience issues, it may have the following implications. The patient cannot be attended into the radiology booking system. Imaging staff have to manually add the patient to the work list and then match the patient with their images. Images may be stuck in a quarantine folder until PACS is aware of the attendance, so consultants will be unable to view them. PACS, the Picture Archiving and Communication System, is used to view the images during reporting and quiz. If there is an issue with PACS, the radiologist will be unable to report on the images. When a patient goes into surgery, or theatre as it's sometimes referred to, the surgeons use the theatre cart to view images during the procedure and to capture endoscopy photos. Theatre carts use an application called TraumaCAD to template images. PACS is used to view images, and an application known as EMS Medilogic is required for endoscopy reporting and imaging. If the systems are unavailable or experiencing issues, endoscopy procedures may have to be cancelled or cut short, while orthopaedic surgeons will be unable to template images, either in preparation for surgery or to view during surgery. All scenarios impose potential clinical risk, and it's therefore imperative the issues are logged as soon as possible in order to minimise any impact or disruption. This also highlights the importance of these issues being raised via the correct channels and the appropriate team being notified to handle and resolve the issue. Bloodhound, or Blood 360, has replaced the BARS system and is used for the releasing of blood or blood transfusions. The application works using barcodes and wireless devices to scan the blood of patients, minimising manual risk factors. The system uses iPods to scan and track the blood, so relies heavily on Wi-Fi. If there is an issue with the Wi-Fi at site, this can mean the bloods have to be matched manually, which opens the process up to potential error. As well as the clinical functions, there are equally important business functions to running the hospital. The administration and financial teams rely on a number of enterprise systems to deliver hospital sales and services. The main systems include Lawson, which is used for accounting and purchasing, and PIMS, which is used by the supplies team to check what equipment needs to be ordered on Lawson. When either of these systems are unavailable, equipment for operations cannot be ordered, which may lead to the cancellation of operations. Another system used on the business side of the hospital is iTrent. iTrent is used for payroll, so the issue if it's unavailable is that employees may not get paid correctly or on time. Business Objects is used for reporting, including cost and profitability. BPC is used for budgeting, planning, and consolidation. Without access to these systems, the business office staff will be unable to produce their reports, which can have financial implications, such as issues with month-end reporting and financial forecasts. As we've seen during our visit, a Nuffield Health Hospital is an intricate and complex working system. Each department, staff member, and IT application play an important role in the continued function of the hospital. It can often be difficult to understand the impact any IT issue can have on both staff and patients within a hospital. Throughout the video, we've identified a number of key systems and how they can affect the staff and the customer journey. We've looked at how applications link together and how the integration of applications is vitally important for the transmission of information. We've also seen firsthand what staff rely heavily on and the issues they deem as business or clinically critical. If you'd like to find out more information about the hospital app supported by Nuffield IT, there are a number of ways you can do so. Speak to the hospital and enterprise app specialists, refer to the knowledge base and tech flows on SharePoint, or you may even benefit from watching this video again. Your virtual site visit is now complete. Thank you for watching.